This meeting is now being recorded.
Hello, and welcome to your 2019-2020 open enrollment. My name is Tiffany Hill, and I work with Brown & Brown Insurance, and we are your employee benefits broker. So today's presentation is being provided to you so that you can hear a high-level overview of each one of the plans that are offered to you through your employee benefits program. Please do keep in mind that if you do decide to make any changes, they will go into effect December 1st of 2019 and go through November 30th of 2020. Your open enrollment period will begin on October 28th and go through November 8th. So please do make sure that if you do plan on making any changes, that you have those in no later than November 8th. This presentation is for out-of-state non-exempt employees. So if you're following along in your Benefits at a Glance booklet, on page number 2, you do have some general information regarding some commonly used terms that we use when we're discussing insurance plans. I'll make sure to explain these more thoroughly when we're looking at the plans themselves. Page number 3 goes over qualifying life events. So I mentioned this is your open enrollment period, which typically your open enrollment period would be the only time throughout the year that you have an opportunity to make changes to your benefit plans, unless you have something called a qualifying life event that occurs in your life. So some examples of this would be getting married, getting divorced, having a child or adopting a child, or maybe having a change in employment status. So if you do experience one of these types of situations, please do make sure to contact Human Resources within 30 days of the date of the event so that you can make the appropriate changes to your benefit. At the very bottom of page number 3, I also wanted to make sure that you knew that during this open enrollment period, we have set up an email box specifically for any questions that might come up after you view this presentation. So if you do have a couple questions, please do make sure to email ROIG, R-O-I-G, questions@bbdaytona.com, and we'll make sure to provide you with answers to any of your questions. So before we look at your plans, I just wanted to take a few minutes to talk a little bit about the member portal with Florida Blue, which is called My Blue Service. So if you're already enrolled in one of the Florida Blue plans and you haven't yet registered on this site, I would suggest you take a few minutes to do so. Once you're registered on My Blue Service, you can do a lot of different things. First and foremost, you can check the status of your claims. You can look at your plan's benefits. If you need to look up a provider or a facility, you can certainly do that as well too. And another great thing that you can do is if you ever lose your ID card, you can order a replacement ID card on the member portal. Secondly, on this page, I wanted to make sure to mention the Blue 365 discount program. So this is specifically for Florida Blue members, and what it is a health and wellness discount program. There's a lot of great discounts that you can enjoy. Obviously, things like hearing and vision care discounts, weight management program discounts. A very popular one is access to a nationwide network of gyms through a company called Tivity Health. So instead of having one gym membership where you pay a monthly fee, you actually pay a $29 monthly fee to have access to a much larger network of gyms. And that's through Tivity Health through your discount program, which is Blue 365. So again, if you're already enrolled in the plans, I would take a few minutes and also register on blue365deals.com so that you can certainly take advantage of those discounts. Also, if you're somebody that's looking for some healthy resources, there's a lot of great included benefits and resources and tips and tools to be able to help you get back on track with your health. If you're looking for access to health coaches, you have access to that via the member portal. And there's also a lot of great web-based information tools that you can certainly take advantage of. Also, the Florida Blue mobile app is very handy to have. So if you have a smartphone, make sure to download that app. That way you can access a lot of the great resources and tools that are on My Blue Service, especially when you're on the go. So here's your 2 medical plan options that you have available to you. So the first plan option is the Blue Options HSA 05190, and then the second plan is the Blue Options 05786. So again, these are two Florida Blue plans. They are both PPO options, hence the name Blue Options. So I'm going to go ahead and start with the HSA plan, which is that middle column there. So before we actually look at how the plan functions, I did want to make sure to mention that you do have 100% coverage on adult and child wellness exams. So when I say that, I'm referring to preventive care. So that's going to be your adult physicals, your child physicals, well woman exams, your routine blood work. Those are all exams and services that you can have done with your primary care doctor that allow you to get some really nice baseline data about your health, and it doesn't cost you anything on your plan. That is also 100% covered on the second plan, but I wanted to make sure I mentioned that on the first plan, just simply because on this plan, you don't have any copays on your doctor's office visits. So I always like to make sure to mention that you don't have to pay anything for your preventive care if you choose this plan. So this plan is actually pretty useful for people that don't typically use their health insurance because a lot of times those types of people are just looking for some coverage on preventive care. So make sure that you at least are utilizing that piece of it if you're already enrolled on this plan. So this plan is the only plan that you have access to that allows you compatibility with an HSA or a health savings account. So if after we go over the plans as well as the health savings account, you decide that you like the idea of having a bank account that you can use for medical, dental, and vision expenses, just keep in mind this is the only plan that allows compatibility with that health savings account. So let's talk about the way this plan functions. So first and foremost, if you're new to this plan, you haven't met your deductible yet of $1,500 or $3,000 per family, you would be in the deductible phase. So that means that any kind of services you have done, as well as prescriptions that you might pick up from the pharmacy, they would all be subject to your deductible. So I mentioned the deductible for individual is $1,500, and then for a family it's $3,000. So on this plan, family refers to any type of coverage that includes dependents. So even if you have just your spouse on the plan, you're going to follow the $3,000 deductible. So just keep that in mind if this is a plan that you're considering. So as you use the plan in the deductible phase, you would just be paying the full cost of your visit up to the total amount of whatever your deductible is. So if the total cost of your primary care physician visit for a sick visit is $100, you would pay the $100, and that would track towards your deductible. Same thing for emergency room, hospital visits, any kind of outpatient surgical facility services you have done, as well as any kind of diagnostic services, that would all be subject to the deductible. Now, I mentioned prescriptions as well. When you're in the deductible phase of this plan and you haven't yet met the deductible, you would be responsible for the full cost of that prescription. Now, once you've met your deductible, you would enter into the second phase of this plan, which is what we call coinsurance. So coinsurance is basically just a split percentage of who's going to cover the bill or the remainder of the balance or any other services after the deductible has been met. So on this plan, it's an 80-20 split. So 20% is what you would pay and 80% is what the plan would pay. Another thing that happens once you reach phase 2 is you would now have copays on your prescription drugs. So once you've hit your deductible, you're then going to either pay $10, $50, or $80 for your prescription drugs. So just keep in mind your cost share significantly decreases for both your medical services as well as your prescription drugs once you've met your deductible. So the third phase or the third part of this plan is if you are to meet your annual out-of-pocket maximum. So that number on this plan is $4,500 for people that have employee-only coverage. And then if you have any dependents on your plan, it's going to be a per-person annual out-of-pocket maximum of $6,850 or a family out-of-pocket maximum of $9,000. So what that number represents is basically your worst-case scenario. As you're spending on the plan, no matter if the dollars are tracking towards the deductible or coinsurance, prescription costs, every dollar is tracking towards that annual out-of-pocket maximum. We think of it as a catastrophic number, and in the event that you ever hit it, then any other covered medical expenses would be paid for by the plan for the remainder of the calendar year. So keep in mind, no matter how big your medical expenses end up being, the most you're ever going to come out of pocket is that annual out-of-pocket maximum. and that does include the cost of your prescriptions. At the very bottom, you will notice that you do have non-network benefits, but you can see that your deductible, your co-insurance, and your annual out-of-pocket maximum all increase. So while you do have access to out-of-network benefits, we don't typically suggest that you utilize those just simply because it means more out-of-pocket spending for you. So that's your first plan option. Your second plan option is going to be that far right column, which is the blue option 05786. So again, blue option does indicate that you have out-of-network benefits. And then the other thing I wanted to make sure to mention is that just like the first plan we talked about, you do have preventive care covered at 100% on this plan as well. So the biggest difference probably between these two plans is if you look at your physician services, you have copays. You also have copays on things like emergency room and urgent care, as well as your diagnostic services. So copays are just flat dollar amounts that you're going to pay each time you have that particular service done. Copays do not track towards deductibles, but they do track towards your annual out-of-pocket maximum. So when you go to your doctor on this plan, it's a $25 copay. Specialist and chiropractic care is going to be a $45 copay. Looking at your emergency room and urgent care, you can see you have a $250 copay for emergency room and then $50 for urgent care. I mentioned you also have copays on your diagnostic services. So again, those are just going to be flat dollar amounts that you pay each time you have those services done. You still do have a deductible on this plan. You can see it's a little bit lower on this plan with $1,000 for individual and $3,000 for family. And then your annual out-of-pocket maximum amounts are a little bit lower on this plan as well too. So it's $4,000 for individual and $8,000 for family. On the very bottom with your prescription drugs, you can notice that you do not have to meet your deductible before you have copays on your prescriptions. So from day one, you'll either pay $10, $50, or $80 on your prescription. Again, this is a Blue Options plan, so you do have out-of-network coverage if you wish to use that. But as you can notice, your deductible, annual out-of-pocket maximum, and your co-insurance amounts do increase if you do go out-of-network. So I mentioned the health savings account, which remember this account can be very helpful, especially if you're taking that first plan. So you can only have the health savings account if you decide that you're going to be taking the first plan I discussed, which is that high deductible health plan where you have to meet your deductible first and there's no copays on the plan. So what is a health savings account or an HSA? An HSA is a tax-advantaged bank account that you can use to pay for qualified medical, dental, or vision expenses. So some of the great things about a health savings account is if you decide to put in money into the health savings account, it's a pre-tax contribution that comes out of your paycheck. So it's coming out prior to your paycheck being taxed. So what that does is lowers your taxable income and obviously makes the amount of income for you to be taxed on less. It's an employee-owned account, so regardless of whether you stay with your current employer, you move jobs, or you end up retiring, that account is your name. If you have a great year and you don't end up using all of the money in the account, that's fine. There's never any kind of forfeiting of the funds. So the money that you have in the account that's not utilized each year just rolls over to the next year, and you can continue using it. Some people actually look at health savings accounts somewhat like retirement accounts because you can end up using them for different types of expenses than you can prior to retirement. So there are some examples of things listed there on page number 6 of what you can use it for in terms of qualified expenses. I mentioned medical, dental, and vision expenses. So the thing about this account, there's a couple things that we need to keep in mind with regards to some rules in place. This is an IRS governed account. So the IRS determines what we can use the amounts on, and they also determine what the maximum amount is that we can put into the account each year. So you'll notice that the max annual contribution amount for 2020 is increasing by $50 for individual only contribution limit. So that amount is $3,550. And then for family, it's increasing in 2020 by $100. So it's moving up to $7,100. If you're age 55 or older, remember there is a $1,000 catch-up amount. So you can actually increase your contribution limit to put into the health savings account. Underneath that, you'll notice those examples I mentioned. If you're looking for a full list of what is considered qualified expenses, you can see IRS Publication 502, and that will provide you with a complete list of what you can actually use the money for. I do suggest that you do keep your receipts just to show proof of what you're utilizing the funds for. In the event that the funds are ever used for non-qualified medical, dental, or vision expenses, there is a 20% tax penalty that you would be responsible for paying. So it's important to keep record of what you're actually utilizing the money for. So remember, this is the health savings account, and this is the account that you can pair with that first plan that we talked about to be able to cover some of your out-of-pocket expenses. All right, so we're going to move on to your dental insurance, which again is through Guardian. Again, if you haven't registered on the member portal with Guardian, it's guardiananytime.com. I would suggest taking a few minutes doing that, just like I did for the medical insurance. So for your dental plans, you have two different options. You have a DHMO option, and then you have a PPO option. So first and foremost, the DHMO option is a plan that has copays associated with each one of the dental services that you can have done on the plan. That's quite handy, just simply because you can know ahead of time what you're going to be responsible for paying before you have the service done. One thing to keep in mind about the DHMO is you must pick an in-network primary care dentist. If you end up going out of network on this plan, you would be 100% responsible for all of the charges. So you do want to be aware of the fact that you have to pick an in-network dentist and you have to stick with that dentist. And there's really no out-of-network coverage on this plan. Your network for this plan is probably a little bit smaller than the PPO plan. So if you're looking for some more flexibility with regards to the network, I would suggest looking at the PPO option. So looking back at the DHMO option, you can see that there are a majority of the preventive procedures that are covered for you with no charge. And then once you start getting into basic and major procedures, there are copays that are associated with all of those services. So again, makes it nice and easy to know in advance what your copay and what your out-of-pocket expenses is going to look like. This plan is also the only plan that provides orthodontia procedures. So you can see there's both child and adult coverage for orthodontia procedures. So if that's something that you're looking for, then the DHMO option is going to be the best fit for you. Right underneath the plan, you can see some examples of how you're going to pick a DHMO dentist. This does walk you through going onto guardiananytime.com and picking a provider. If you do not pick a provider on this plan, one will be provided for you. You can always change it later. But if you already have a dentist, I would suggest just going onto the guardiananytime.com and finding their PCD ID number, and that way you can continue using that same dentist. So your PPO option is to the right of that plan, and a couple key differences here. The very top line talks about an annual max benefit, which on the PPO is $1,500 per person. Now, the DHMO that I just went over with you does not have an annual max benefit at all. So there's kind of an unlimited amount of how much the plan is going to pay on your behalf. Whereas on the PPO, you have a $1,500 annual max benefit, which is kind of like your bucket that you have to spend on your dental services throughout the year. So that's the amount that Guardian is going to pay on your behalf. And then any other person that you have on the plan with you also would receive $1,500. There is a deductible of $50 or $150 for family, but that deductible is waived for preventive procedures. So exams, cleanings, x-rays, those kind of services, the plan is going to pay 100% of those costs, and you do not have to pay your deductible. Now, basic procedures, there's just going to be fillings, surgeries, root canal therapy, and anything periodontal related. The plan is going to pay 80% of those costs, and then you're going to pay the other 20% after you've paid your $50 deductible. Major procedures are covered at 50%. So that's going to be things like crowns, bridges, dentures, and implants. And then, of course, you'd pay the other 50%. You can see there's out-of-network benefits. So I mentioned to you, if you're looking for some flexibility, then I would suggest the PPO. So keep in mind, if you have an out-of-network dentist, I would choose the PPO so that you can have at least some coverage. You can see there's a little asterisk next to the amount that the plan is going to pay for you. What that little asterisk indicates is you can sometimes be balance billed. If your out-of-network dentist is charging more than what the maximum allowable charge is for that particular service, then of course you would be responsible for paying the difference between that maximum allowable charge and what your dentist is paying. So that's called balance billing. That only occurs when you're going out of network, but certainly something to be aware of. The last thing at the very bottom on the PPO is the maximum rollover program, and that is only included with the PPO. So what that is an opportunity for you to maximize your annual max benefit. Remember I said that's $1,500 for this plan. You have an opportunity to roll over an additional $500 the following year if you do not spend more than $700 of your $1,500 annual max benefit. So as long as you don't spend more than $700, you stay within that threshold, the following year, you're going to roll over $500. If you go out of network, you're going to roll over $350. The most that you can have in your rollover account is $1,250. And if you've already been on this plan before last year, I would suggest going to Guardian anytime, or you can even call them and find out how much is in your rollover account limit. The more you have in your rollover account limit, you can tack that onto your annual max benefit and make the most out of the plan, paying for some maybe more basic or major type procedures. So that's a nice little added feature to the PPO. Moving on to your vision insurance coverage through iMed. So this plan is going to cover three things: your eye exams, your glasses, and if you wear them, contact lenses. So there are some frequencies to be aware of, and we'll go over those. Before we talk about that, if you're new to this plan, do make sure that you're looking at providers in the Insight network. So you're going to go to imedvision.com and then choose the Insight network. So your eye exams are covered every 12 months for a $10 copay. Your basic lenses are covered every 12 months as well for a $25 copay. And then your frames are separate. So with frames, you have $130 to spend every 24 months. If you spend more than the $130, you do get a 20% off discount on the balance. So keep in mind, lenses are covered every 12 months and frames are covered every 24 months. Now contacts, if you wear both eyeglasses and contacts, you have to make sure to choose one per year. The plan is only going to pay for contacts or eyeglasses. So 1 year have your contacts paid for, the next one have your eyeglasses paid for. If you only wear contacts and you don't wear glasses, you can have those contacts paid every 12 months, and the plan provides you $130 for those. Now you can use this plan out of network if you choose to do so, but it's more of a reimbursement plan where you would pay out of pocket and then you would submit to be reimbursed up to a certain dollar amount. The bottom half of the page talks about some other great discounts and ways to save on your eye care. So at Sears Optical or Target Optical, you can enjoy any frame, any price for $0 out of pocket. So that's great savings. And then if you wear contacts, ordering from Contacts Direct allows you an additional $20 allowance back onto your $130 allowance. So it's convenient, and of course you have a little bit more tacked onto your allowance for your contacts. All right, moving on to your disability coverage. So both your short and long-term disability coverage is going to be voluntary. So what that means is if you decide that you would like to enroll in either one of these plans, then you would just pay for the premium out of your paycheck just like the other plan. So starting with short-term disability. Short-term and long-term disability are what we consider paycheck protection, because in the event of an illness or an accident, you still have to obviously pay your bills and maintain your financial responsibilities. And so having disability coverage really does ensure that you can protect at least a piece of your paycheck if you're ever ill or have an accident so that you can no longer work. If either one of these coverages sounds good to you and you're looking to enroll in them for the first time, please do make sure that you do fill out an evidence of insurability form if this is not the first time you've been offered this coverage. The evidence of insurability form is simply just a medical questionnaire that you're going to fill out and have sent off to Guardian. If you're new and you've never been offered these coverages before, then you do not have to fill out the evidence of insurability. You can simply just enroll in the plans and you'll be covered for both of these. So short-term disability is going to start after you've been out due to an illness or an accident for 7 days. So the benefit's going to start paying on the 8th day, and it's going to replace 60% of your weekly earnings up to a max weekly benefit of $500. And you can actually receive the short-term disability benefit for up to 12 weeks. If you've already been on the plan for 12 months, you do not need to worry about the pre-existing condition exclusion. But if you're new and you're just joining the plan as of this December 2019, one thing you do want to keep in mind is there is something called a pre-existing condition exclusion, which basically says that any claims that are put in the first 12 months after the effective date of coverage would be subject to this exclusion. So Guardian would look back 3 months prior to your effective date to see if this is a pre-existing condition. So have you been seen for this? Have you been treated for it, diagnosed with, or maybe taken prescriptions regarding this claim? If the answer is yes, then unfortunately that particular claim would not be paid out. But if the answer is no, then of course you would receive the payout for the claim. Keep in mind that's only for the first 12 months of you being on the plan. After you've been on the plan for 12 months, you do not need to worry about that. So if you've already been on the plan and you'd like to keep it, you don't have to worry about that pre-existing condition piece. So moving on to the long-term disability, which is very similar. The big difference is the long-term disability is going to pay on a monthly basis versus a weekly basis. So if you're insured on the short-term disability plan and you also would like to purchase the long-term disability plan, they marry up to each other so that once those first 12 weeks are done on your short-term, the long-term disability is going to kick in immediately. Now, if you only are enrolled in the long-term disability, there is a 90-day waiting period. So you do have to be out of work for 90 days due to a covered sickness or accident before the benefit's going to start paying. So again, this benefit is going to protect 60% of your monthly earnings up to a max monthly benefit amount of $3,500. This benefit could potentially pay up to your normal Social Security retirement age if you are completely disabled. If you're just disabled in your own occupation, it does protect you for up to 2 years. Very similar to the short-term disability, this policy does contain a pre-existing condition exclusion as well too, and it's for the same amount of time. So in the first 12 months of being on the plan, they will perform a 3-month look back just to see if you were seen, treated for, or diagnosed with anything regarding the claim that's been submitted. Again, if you've already been on the long-term disability coverage for a year now, you do not need to worry about that because it's only for the first 12 months of being enrolled. So both of those plans, as I mentioned, are voluntary. If you are interested in purchasing and being enrolled in either one of these plans, the next page on page 10 does have your calculation worksheets. It's just some simple math to figure out what the per paycheck cost would look like. So the top one is for the short-term disability benefit, and the long-term disability benefit calculation worksheet is right underneath that. The long-term disability is based on age, so there's you can see the age bracketed rates there that you're going to include when you figure out the calculation for the premium. Again, if you do have questions on this, please don't hesitate to reach out to us at roigquestions@bbdaytona.com. All right, your life and accidental death and dismemberment insurance coverage with Guardian is the next coverage we're going to review. So the top part in the light blue box talks about your basic life insurance. Remember, your employer provides to you 1 times your salary up to a maximum amount of $50,000 of life insurance at no cost to you whatsoever. So that's a nice starting point for your life insurance. If you're interested in purchasing some additional life insurance, that's going to be the voluntary life insurance on the bottom half of the page. So if you're new to the plan, you actually can get up to the guaranteed issue amount of $100,000 for employee and then $25,000 for spouse. If you've already been offered this benefit before in the past and you've declined it, similar to the short and long-term disability, you will have to fill out an evidence of insurability form for any amount elected. You can enroll in increments of $10,000 up to a max amount of $300,000 for yourself. And then for spouse coverage, it's in $5,000 increments up to a maximum amount of $150,000. Keep in mind on the spouse coverage, you cannot exceed 50% of whatever you elect on yourself. For the child life insurance coverage, you do have a $10,000 policy amount, for children aged 14 days to 26 years old. And then on the following page, which is page number 12, you'll see the age bracketed rate. So that can help you figure out what the cost is going to look like for your additional life insurance. So keep in mind, if you are purchasing additional life insurance, you can tack that on to what your employer is paying for you to have, which is that 1 times your salary up to a max of $50,000. When calculating the spouse premium, keep in mind, it is based on your age as the employee. So the costs do increase. You can see the rates increase every 5 years. So if you have a birthday that pushes you up into the next age bracket, then of course that would increase your cost for your voluntary life insurance. The child life insurance is at the bottom left there. It's $1.88 per month, and that is regardless of how many children you are insuring for the $10,000. That bottom right-hand blue box is how you figure out your voluntary life costs per paycheck. So a couple additional services that I wanted to mention. If you are enrolled in the dental PPO plan, you do have access to the Guardian College Tuition Benefits Rewards Program. So you do want to make sure that you register for this program, but if you haven't already registered and you are already enrolled in the PPO dental plan, you are already accumulating tuition rewards. What you do want to make sure that you do is register on www.guardian.collegetuitionbenefit.com and make sure that you end up giving the rewards to either your children, grandchildren, nieces, nephews, or godchildren. You don't want them to go unused. So they are accumulating, but at some point you want to make sure that you are registering and then saying who you wish to give these rewards to. So being enrolled in the PPO dental plan earns you 2,000 tuition rewards, and these can be used at over 380 private colleges and universities across the nation. So each reward equals $1 in tuition reduction. And keep in mind, the list of colleges and universities is ever growing. So you can go ahead and take a look on the website and see which colleges and universities are currently participating in this program. So again, it doesn't have to be just used for children. You can actually give the points to grandchildren, nieces, nephews, and godchildren as well. So that website is www.guardian.collegetuitionbenefit.com. And again, remember, you are accumulating tuition rewards points if you've already been enrolled in the PPO dental plan. So the last additional service I wanted to mention is your employee assistance program through Guardian, which is called Work Life Matters. This is a confidential, no-cost service to you where you have unlimited free telephonic consultations with EAP counselors, and that's available to you 24 hours a day, 7 days a week. You can call in and make use of speaking directly to these counselors. They can actually refer you to local counselors, and you have up to 3 sessions free of charge face-to-face. So just remember that you have this benefit. It doesn't cost you anything more, and it's completely confidential. So there's no reporting that goes back to your employer letting them know whether you're using this or not. We just want to make sure that you know you have access to it. So the last couple pages in your Benefits at a Glance booklet do include some important notices, and those are there for compliance purposes. The very last page does include state information for all states that have Medicaid programs. So if that's something that you're interested in knowing more about, you can certainly reference the last page of your booklet. Just a quick reminder, if you are going to be making any changes, your open enrollment period does go from October 28th through November 8th. So please do make sure that you get your changes in a timely manner so that we can go ahead and process those. I hope you found this presentation to be helpful. Again, if there's anything that we can do in terms of answering questions for you, please don't hesitate to email the open enrollment email box at roigquestions@bbdaytona.com. Thank you so much for listening and have a great rest of your day.